It is no secret the pandemic helped expose and worsen a mental health crisis, especially so in children. In the last few years, emergency rooms have seen a spike in the number of kids coming for mental health services. And tonight, Sammy Salina met one family that knows firsthand the importance of seeking help.
Oh no.
Levi loves everything a kid likes. Playing catch.
Annoying?
And complaining about his little sister.
Like
More
most
annoying.
brothers would describe a sister.
That's how his mom,
More annoying.
Sarah Olson, likes it.
Ready?
Don't hit the camera.
Protect
Mom.
the camera.
Okay.
He's starting his very first season of baseball soon.
It distracts me, and it's actually a sport that I can play that doesn't hurt me.
And a new season in life.
It's hard being a kid with a condition like his, where it's like, the more he is a kid, the more painful it is.
He was born with spina bifida,
Whoa!
Whoops.
a condition that impacts the spine. But his mom says he's always been positive.
The light to everybody around him, that's just who he is.
But she says this past fall, his glow dimmed.
I started feeling like bad about everything, like I didn't want to be here anymore.
It went from happy-go-lucky Levi to, I don't want to be here anymore, Mom.
Doctors told her to bring him to Children's Minnesota.
Are they gonna look at me like I'm hurting him, or I've done something, or I'm lacking somewhere? And that was just the exact opposite.
There's been an ongoing increase in demand for mental health services for kids.
Jessica Brisbois is the manager of acute mental health services at Children's. She says in the height of the pandemic, they saw a 30% increase in kids coming to their emergency rooms for mental health.
The numbers have steadily been climbing every year.
It's took a toll on me.
In Levi's case, his physical pain started impacting him mentally.
They looked at Levi and just said, "We believe you. We believe that this is this hard."
He spent a week in inpatient care.
After I left, everything got better.
And after that, he continued with the patient's partial hospitalization program during the day, which aims to improve symptoms and teach coping skills.
It brought Levi back to me. It saved his life. It saved my son's life.
Levi says he's doing a lot better.
I'm happiest doing what I love, like baseball, playing with my friends, video games, just being a kid. This golf is weird. Mom, what the?
He admits there still can be tough days, but it helped him to learn that others were struggling too.
When I was going through it, it was like, nobody understands me. And I just wanted to tell them that I thought it too, and you're not alone.
He says that's important for kids to know.
You are amazing.
Average.
So they can start feeling like kids again. Sammy Salina, KARE 11 News.
Children's Minnesota recommends that if your child is experiencing a mental health emergency or imminent risk for harm, call 911 or go to the nearest emergency department for a mental health evaluation.